Good afternoon, everyone. Thank you for joining us today for today's webinar. For this session, we'll be reviewing the pharmacy interface module in Therap. We'll be doing a detailed overview of that interface and how it works in conjunction with our medication administration record, or MAR. My name is Fayon Johnson. I am the Assistant Director of Interoperability here at Therap, and I'm going to be your presenter for today. Before we begin with the demonstration portion of today's webinar, there is a little bit of housekeeping that I want to go ahead and go through with you guys. The first thing that you all should know is that anything that I show you guys today is for demonstration purposes only. You need to make sure that you're following any appropriate rules, guidelines, regulations for your state, for your county, and also anything that may be addressed or needs to be addressed by your agency. I also want you to know, and I'm sharing with you right now, our retention of rights slide. This information is for your review, and it just lets you know that we do maintain the rights of all of our intellectual property. This session will be recorded for quality assurance and training. So if there's anything that you see on today's webinar and you'd like to be able to go back and review that, we do post our recorded webinars on our support site, which is at www.support.therapservices.net. And I'll show you guys how you can access that later on in the session. So you'll be able to go back and review this webinar and share it if necessary with any of your colleagues. If you have any questions for me, please feel free to use the question section of GoToMeeting or raise your hand. You probably have all noticed that right now, by default, you all are on mute. That's not because we don't want this to be an interactive session, nor are we discouraging questions. It's really to sort of keep things going and keep background noise to a minimum. So if you do have any questions, please feel free to go ahead and drop those in the question section. Towards the end of the session, I will give you guys the ability to raise your hand so that if you need to ask something out loud, you can be temporarily unmuted to do so. Please feel free to also use the GoToWebinar chat section to talk amongst yourselves or ask or share information. But if there are any questions that you want addressed out loud and live, please do use the question section of the webinar for that purpose. A little bit about me. I've been with Therap since 2013. I'm based just outside of Raleigh, North Carolina. I am a nurse by education, even though that's not necessarily what I'm doing by trade. I do work primarily with the pharmacy interface and the health information related modules here in Therap. So if you have any questions about this module, the MAR module, or some of our other interoperability offerings, please don't hesitate to reach out and let me know. With that being said, we're going to go ahead and shift gears and hop over into the application. There are a couple of things that you guys need to know both about the pharmacy interface and the MAR module. Both are add-ons, meaning they're not included in the basic Therap package. So if you're interested in using MAR, you can do so. And if you want to add the pharmacy interface portion, you can do that as well. It is important to note that our MAR is a standalone module, meaning it can work inside of Therap without the addition of pharmacy interface. But the value added benefit of having that pharmacy interface module is that you have that direct connection to your external pharmacy, and they can send messages to you in real time, letting you know about medication changes, updates, treatments, and the like. Currently, we support 3 types of interfacing software. For record, those are the QS1 Prime Care interface. We also do the Framework LTC interface, and we also have the SpeedScript interface. So if your pharmacy uses any of those software packages on their end, then they do have the ability to connect with us here at Therap, and that pharmacy interfacing becomes an option for your agency. I know that there has been some interest in some additional pharmacy software packages, and we are currently actively exploring that and hope to add additional packages in the future. With that being said, I am now going to switch over into the application and walk you guys through that setup process. All right, so you all should be able to see my Therap dashboard. When you're getting ready to implement the pharmacy interface module, one of the first things that you need to start thinking about is who's going to participate in this process. Often when I'm doing pharmacy interface trainings, I tell folks that there are typically two groups of staff that are going to interact with it. You're going to have those folks that are going to be known as your pharmacy interface administrators, and then you're going to have the folks that I like to call your pharmacy users. Pharmacy administrators are responsible for the initial setup of the interface module, but are otherwise pretty hands-off. They kind of set and forget it unless there's some sort of troubleshooting or some adjustments to the settings that need to be made. Your pharmacy users are the folks who do sort of that day-to-day or more frequent interaction. And those often tend to be your nurses, your program managers, sometimes your med-certified staff, depending on the structure of your agency. And so once you've identified who's going to need to participate, the next step is to come in and to assign those roles and privileges accordingly. So the first thing you'll do is come over to your admin tab. You'll come over here to user privileges, and for the folks that need to be responsible for the setup, who need to be administrators, they're going to come in here and you're going to assign to them this pharmacy provider admin role. Okay. If you have purchased Pharmacy Interface, but you're not seeing that pharmacy provider admin role, in all likelihood, it hasn't been activated for your agency. Typically, I wait to do the activation immediately prior to our first scheduled call. So once I reach out to you and let you know that the background setup has been completed and you've been linked to the pharmacy, I'll schedule some initial training time with you, and then I'll activate the pharmacy provider interface before that. So if you're not seeing it and you have pharmacy interface, it may just mean that we need to get our call set up, and then those options will be available. So long story short, you're going to click on this pharmacy provider admin role. You're going to go ahead and you're going to save those changes. You can assign this to multiple staff. Okay, so once you've decided who those admins are going to be, come into the application, assign them that provider admin role, and once they log in, they're then going to notice at the bottom of their admin tab that they have access to this pharmacy interfacing section. The pharmacy interfacing section will be divided into three parts, and we're actually going to work our way from the bottom up. The first thing that your pharmacy admin is going to do is they're going to set up what's known as a message worklist configuration. If you've been using Pharmacy Interface for a while, you may not realize that we did introduce this message worklist configuration. This was a little over a year ago. And what this message worklist configuration allows you to do is set up some rules about how the system is going to interact with the messages you're receiving from the pharmacy. The first thing that you can do is set what's known as a worklist expiry day. So when the pharmacy sends you a notification about a new order or a refill or a change, you will get a memo or a note, a count, if you will, on your to-do tab that does require some attention and review. If you do not address or acknowledge those notifications, the system will continue to prompt you about them for 30 days by default. You can change this setting to 15 days or 7 days if you don't want those reminders to be there. After the expiry day that you indicate here has passed, the notifications will disappear from your to-do tab, but you will always have access to the information if you go into the database and search for it. So worklist expiry day is how long does the system remind me that I have information available from the pharmacy if I have not addressed it. If you address it, those notifications are going to disappear right away. Next, you have this priority configuration section. What the priority configuration section allows you to do is dictate when messages of a particular type are sent your way, how they need to be organized, and you have the ability to assign high, medium, or low priority to them. Okay, over here on the left is a full list of message types, which we refer to as order controls. And one of the things that I'm going to do with you on your setup call is review the message types that your pharmacy in particular is sending you, because not all options are used by all pharmacies. And then you're going to decide for each particular message type that we've identified how you want to go ahead and label that. Some options include new orders. So anytime the pharmacy sends you a new order, how do you want that prioritized? And I might come in here and I might assign that high. If the pharmacy sends me a discontinue notification, perhaps that is also something that I wish to flag as high. Other options include things like refill. So when you get that refill order notification, how do you want those prioritized? I might choose to mark those as low. If a pharmacy sends a change notification, which depending on the pharmacy can be something as simple as a billing change or an NDC change, you might choose, again, to come in here and prioritize that differently. And so the idea is, based on the available types from your pharmacy, you guys are going to come in and you're going to determine, based on your agency's needs and priorities, how you want this addressed. Okay? If there is a particular message type that your pharmacy sends that you are not interested in receiving notifications for, you can choose to filter those out. Anything that does not have a Worklist priority assigned to it will be filtered out and you will not receive notifications for it. So if I decided that my organization didn't need to see every monthly cycle refill order, because it doesn't require us to update our MARs, we have lots of meds, we want to be able to sort of get to what's most important. If I want to filter those out, then I'm simply not going to assign any priority. So you can see that I've removed that refill order notification. And if the pharmacy were to send me a notice indicating that there was a refill order, I would not get that notification. I will, however, always have access to the data. I'll be able to go in and search the database for it. So if I needed to see it, I can still access it, but I will not be automatically notified about it. And so once I've decided what my Worklist priority is going to be, I'll come in here and I'll update that. I'll get a notification from the system that those changes have gone into effect. So I can see here that that's been successfully updated. I can adjust my Worklist configuration at any time. So if I decided that, you know what, we really do need to see those refills, I want to go ahead and turn that right back on, I can come into this Worklist configuration, same way that I accessed it before, make whatever changes I need, and then go ahead and update that. The key thing to keep in mind is that the changes are not going to be applied retroactively. So what that means is if I change it now, everything that comes in after the change will follow those rules. Messages will always follow the rules that were in place at the time that they were received. So that's the first step in getting this set up. We're going to come in here, assign our administrators, and then whomever that administrator is, they're going to come in here and they're going to set the message Worklist configuration. That message Worklist configuration applies to the entire organization. Okay, so one person comes in, sets the rules, and the entire agency is going to go based on what those rules are. Next, you want to confirm that the interface is in fact working, that we've done all of our back-end connections, and we're going to go in here and verify that you're getting meds from the right pharmacy for the right individuals. The simplest way to do that is to come in here and do a pharmacy message search. So when I click on the pharmacy message search option, I come to my search page, and there are lots of criteria that I can use to find a particular message or medication for an individual or set of individuals. My goal today is to find all of our new individuals who have not yet been added and linked. So I'm going to set a filter for individuals who are pending mapping. To be clear, you are not required to use any of these filters. You can come to this page, leave everything blank if you just want to take a look and see what all's in there, and then you can scroll down to the bottom and hit search. Either way, the system will bring up the result, okay, depending on what you may or may not have filtered for, and your screen will look something like this. You'll be able to see the name of the pharmacy that you're receiving messages from. It is important to note that it is possible to be linked to multiple pharmacies. So if you're a larger agency that's spread out across your state, you may be linked to 2, 3, 4, or more pharmacies. And so we do include the pharmacy name here so that you can see which pharmacy it's coming from. There's also a column that says Pharmacy Individual. This is who the pharmacy is identifying that the medications listed here belong to. So our demo pharmacy is saying that this Advil belongs to a person that they are calling Brittany Adams. When I look at the column that says Therap Individual, I'm going to notice that it says NA. And that's because, at least by default, our application has no idea who Brittany Adams is. In all likelihood, you have created an IDF for Brittany, and she does have a profile in your system, but our system doesn't automatically take a look and say, oh, Brittany Adams from the pharmacy must be Brittany Adams over in our residential group home. It is the responsibility of the pharmacy admin to do that one-time crosswalk to tell each unique system that these are in fact the same person. And to facilitate that, the pharmacy creates what's known as a linked individual ID. This code is determined by the pharmacy at their discretion, but each individual will have a unique ID. You only need this information for the purposes of linking. It will not be used elsewhere in the Therap application. And so what you can do is click on any message for that individual. It's going to open up, and then you're going to be able to copy that linked individual ID because you're going to need it in just a moment to link it to their Sarap profile. Alternatively, instead of having to look for and open up each person to locate their individual ID, you do have the ability, when you come in here and you do that pharmacy message search, you do have the ability, after pulling up your results, to export that data into Excel, where you can really quickly do a sort and filter, you can hide duplicates, and sort of create a cheat sheet, if you will, that has everyone's name and everyone's linked individual ID available to make it faster to go back and list, or rather link, additional individuals. So right now, we've got our ID for Brittany, and we're going to complete the last step of the setup process as an administrator. The final step, as mentioned before, is to link the individual's pharmacy profile to their Therap profile. To do so, I'm going to click on Link. I'm going to select the individual's name. So we're working with Brittany. And then I'm going to drop that ID that I just got from my search. From there, I'm able to link to the pharmacy in question. And when I click on Next, the system is going to bring up the demographic information that's available in my system and the demographic information that's available at the pharmacy side. My job as the administrator is to review the data in each of these columns to confirm that these are in fact the same two people. It's very important to make sure that you go through this carefully. Make sure the names match, make sure the dates of births match, make sure Social Security, gender, address, phone number, etc., any and all available information matches. If we notice that there is a discrepancy, so for example, I can see here that the gender is different. In Therap, we have Brittany listed as female. At the pharmacy side, they have Brittany listed as male. So if we do notice a discrepancy, if it's in the Therap column, it's as simple as going back and updating your IDF. So if I needed to go back and change her gender because I had it wrong, I would go back and I would update my IDF, and that would be that. If the information is incorrect, missing, so on and so forth, in the column that says pharmacy individual, you need to reach out to your respective pharmacy and say, hey, you're sending over Brittany's gender and it's incorrect. Can you update that? When they make the update, the information is then going to be reflected here based on the most recent message that has been received. To be clear, you can still link individuals who have information that isn't an exact match. In fact, you can accidentally link two people who aren't the same to one another. And that's why I say that you need to be careful when you check this information. You want to make sure that it's accurate, because once you come in here and you hit link, I always like to jokingly say they are forever united in Therap matrimony. You do not have the option to unlink, change, break, or otherwise modify this. And what the system is doing when you click on link is it's pushing all of the data associated with this person into the profile of the person in the Therap column. So if I were to click on back to form, again, no option to change, no option to unlink, no option to modify. And so I definitely want to take my time and make sure that I'm doing this for the right groups of people. You'll notice that there is an option to sync messages on this page. This exists because periodically our individuals may change services or locations. And oftentimes that requires an update on the pharmacy side as far as where those meds need to be sent. To make sure that there is no data loss, if you do have individuals that change service, when you update their program enrollment, you may wish to come in here and periodically click on the sync message option to pull anything that might be attached to a previous service for that person. And to show you how I got here for future reference, if you do need to ever do a sync, you would just come back to this link individual section and click on search. You'll be able to then find the individual. So in this case, we'll pull Brittany right back up. And once she shows up here, I have access to that sync option to go in and pull anything that may have been sort of floating in space. That wraps up the setup portion of the pharmacy interface for administrators. So as a quick recap, I'm going to make sure that my message worklist configuration is in place. I'm going to search the database to see any messages that I've received and locate the IDs for the corresponding individuals. And then once I have those individuals once per person, so not for each med, not for each treatment, but once per person, I'm going to come in here and I'm going to link their pharmacy profile to their Therap profile. I'm going to pause here for a minute or two, see if we have any questions about that setup process. If we don't, we're going to shift gears into what a pharmacy user does, how the information presents when it's received from the pharmacy, and how we use that to build a MAR. All right, so let's check and see if we have any questions.
No, Fayon, no questions at this time. We just kind of lost a little bit of audio at one point, but then you kind of went back and reviewed it once again, so thanks.
Awesome. All right. And again, if there's anything that isn't clear, you guys can't hear me, just let me know. But we'll just keep going. So now that we've done that, the next step is to come in here and make sure that those folks who are going to be our pharmacy users, so our nurses, our program managers, our med techs, whomever those folks are, whoever's going to be responsible for managing and updating the pharmacy, we want to make sure that those folks have access to the right parts of the system. And so for those folks, we're going to want to go in and adjust their super roles. Let me make a quick change here to my privileges. Okay. And so for our users who need to be able to access the messages, need to be able to access the MAR, we're going to want to go into their super roles, click on manage. So I'm going to open up my medical super role here. And I want to make sure that those folks have access to the following. First and foremost, we want to make sure that they have access to health tracking. The medication forms are tied to our health tracking module, So we want to make sure that they can submit them. We want to make sure that they can view them. If applicable, perhaps we also want to make sure that they can update and or delete them. There are some additional reports and review options. So again, depending on the group of staff that you're assigning this to, you're going to want to come into this health tracking section, and at a minimum, we want to make sure that they have this submit role. If they are also going to be responsible for processing the MAR or approving the MAR, we want to make sure that they have that MAR configuration approve role. If they need to be able to submit data on your MAR, we want to make sure that they have the ability to submit data. If they're going to be authorized to go back and make corrections, we might choose to give them that update role. If this is a group that just needs to be able to view the MAR for reference purposes, but not otherwise be able to document on it, then we may choose to only give them that MAR data view role. So again, based on the group of staff that you're assigning this to, you want to make sure they have health tracking. You want to make sure they have the appropriate MAR roles. And most importantly, if they need to be able to see information from the pharmacy, you're going to want to make sure that they also have the pharmacy role. There are two options for pharmacy roles. The first is to acknowledge. Users with the acknowledge role can take the information that the pharmacy has sent and transfer it to the MAR. Users who only have the pharmacy message view role can see the data that the pharmacy is sending, but cannot otherwise take action on it. So if you have parents or guardians in your Therap accounts who wish to be able to see information from the pharmacy, but of course you don't want them to be able to use that to modify your MARs, then you can choose to give them just this pharmacy message view role if applicable. So again, you're going to pick and choose what folks need. The main takeaways are that they are going to need to have access to that pharmacy message acknowledge, and they are going to need to have that health tracking submit in order to access what we need to build these MARs. Now that everyone's got their roles, we can get to the meat and the potatoes of this thing. So for your pharmacy users, again, your nurses, your program managers, your med techs, whomever, this is what a notification from the pharmacy looks like. When they sign in on their to-do tabs, they're going to have this pharmacy message section that is going to appear, and they're going to have counts broken out according to the rules established by your Worklist configuration. So earlier, when we went in and we said these messages are high priority, these messages are low priority, we don't want to know about these types of messages, that dictates how this is going to appear. It's also important to note that a user will only see pharmacy messages for a client who is on their caseload. Okay, so if my agency serves 10 people, but I only work with 2 of them, even if I have access to pharmacy messages, I would only ever see pharmacy messages for the 2 that I have on my caseload that I'm authorized to work with. That being said, these individuals also have to be linked. So the pharmacy admin will have needed to complete their setup part, what we just covered a few minutes ago, in order for me to be able to see this information. To start, I can choose to focus on messages of a particular type. So if I clicked on this option, it would just show me my highs. If I clicked on this option, it would just show me my lows. If I click on acknowledge, it's going to show me everything available in a list, with the most recent one being on top. For today's training, we're going to go ahead and we're just going to start with our high priority items. When I do that, the system is going to show me what's been sent. And I can see that for Brittany, I have a new order for her Advil, okay? And then I have a discontinue order for that Advil. So depending on what it is that I need to do, or if these were different medications, I would click on the message in question. And for training purposes today, I'm going to go ahead and I'm going to start with that new order. When I click on it, the system opens up and it allows me to see the message information. At the top of the page, our system has a group message section. So if I receive multiple messages about a specific prescription, so if I received multiple messages about this prescription, they would be listed here so that I could follow the sequence. I could see that it was a new order on April the 22nd, then it was refilled a month later, refilled, 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 and then subsequently discontinued 6 months after that. So I would be able to see everything related to this prescription in this section here if I had more than one message. I'm also able to see the status of each of those messages. And if I had multiples, I'd be able to toggle back and forth between the different messages to see what was going on. Below that, I can see the message information. And I'm going to be honest with you guys, there's a lot of information available on this page. Everything from the pharmacy that prescribed it, the pharmacist that signed off on it, the doctor that authorized it, the medication information, which med, NDC code, how much to take, instructions, any generic names, the route, start date, stop date, message type, etc. So there is a lot of information on here. What you guys are going to realize over time, though, is that as it relates to your MAR, what you need to know is going to be in this section called Selected Fields for Medication History. So you can see I've got my drug name, I've got my code, I've got my strength, I've got my form, I've got my instructions, my route, start date, stop date, frequency, etc., etc., etc. If there were any medications previously added to the MAR related to this message from the pharmacy, they would show up here. But I can see that it's a new order. It also indicates that no medication has been created yet. And so I, as the pharmacy user, need to review this and determine if this is something that needs to be added to my MAR or not. If this was something that I did not need to add to my MAR, for example, this was a refill notification, this medication has been on our MAR for the last 3 months and is otherwise unchanged, then I would come in here and I would simply acknowledge this message. By acknowledging the message, all I'm saying is, thank you for letting me know. It does not change anything in the application. In fact, the only thing that's going to happen is your count is going to be decreased. So let me show you what I mean. If I come in here and I grab this message and I review the data and I simply acknowledge it, I get notification from the system that it's been acknowledged, but nothing changes with the exception of my dashboard count. So if I go back to my dashboard, instead of having 2 high-level messages, now I have 1, but nothing else has happened, okay? If my intention is to use that documentation for the MAR, instead, I want to make sure that I use the acknowledge and create option. Okay, so I've reviewed this. I can see that I don't have a medication created for this particular prescription, and my goal is to add it to my MAR, so I'm going to click on Acknowledge and Create. When I do that, it takes me to my medication history form. For those of you who are using MAR but did not have the option for pharmacy interface or are not currently using pharmacy interface, this screen is probably pretty familiar. I like to call the medication history forms the gateway to our MAR. Anything that exists on a MAR in Therap, there is a corresponding medication history form for. Without the interface, you would be responsible for filling this out manually. With the interface, you can see that a lot of the information is pre-populated for you. So I can see the pharmacy, the doctor, the prescription number. I can see that the drug has been entered with the corresponding link to First Drug Database. So I don't have to guess what the NDC is. I don't have to try to figure out what the medication is. I have access to that, the manufacturer, any subsequent names, a picture of that, indications, side effects, and so on and so forth. So that comes over automatically with the interface. The interface also is going to populate the instructions. So every day at 8 a.m., take 1 tablet. It's going to populate the route. And then it's also going to indicate the instruction and comment. So all of that comes over from the pharmacy message, gets embedded into the medication history form, so that all you really truly have to do is review the data, okay? You do have the ability to make edits. So for example, if I opened up this form, I can choose to assign it to a service. So I'm going to assign this to the group home. Okay. I can choose to assign a medication type where I specify if this is a scheduled medication, a PRN medication, a scheduled treatment, or a PRN treatment. This field is not required, but I often tell folks to treat it as though it were because it makes for a much more user-friendly MAR and also allows you guys to do some really cool quality assurance reporting after the fact. So you can come in here and you can indicate whether it's scheduled, PRN, etc. Here in the administration details, again, they'll be pre-filled for you, but you can adjust them if needed. So the pharmacy sends this over as 8 a.m., but we actually administer at 8:30 a.m. at this particular home or for this particular individual. So I could come in here and I could adjust that if needed. The pharmacy has sent the frequency over as Q1D, but as my agency, we like to spell things out. We don't want to use these acronyms. We don't want to have any confusion. So I might come back in here if I want to, and I might adjust that to say, take 1 tablet daily instead, okay? Depending on your pharmacy, they may also send what's known as an end date. An end date tells our system when a medication should fall off or expire from your MAR. So according to the end date, staff will no longer be able to document past this date or time. If your pharmacy does not send an end date, what that means is that the medication will remain on your MAR indefinitely until manually discontinued instead of being automatically stopped as of the date and time listed here. Okay, so if you want to, you can make changes to those sections, okay? For example, they might have sent it as PO, but she might be someone who's on a G-tube. So if there's any discrepancy, anything that you want to make clear, you can go ahead and you can adjust that. Once you've done any changes that you'd like, you're going to go ahead and you're going to submit this form. When you do so, the system will give you a warning. It's going to let you know, hey, by the way, you forgot to add information in the fields listed here. Here's the disclaimer, okay? These fields are not required. We encourage you to add as much information as you can into the different parts of the medication history form because it will allow you to do lots of different things throughout the Therap application. However, for training purposes today, I have focused only on the fields that display directly on your MAR. So you'll notice that there were sections that I did not address. To be clear, that doesn't mean that you can't fill them out. It doesn't mean that you shouldn't fill them out. But as far as what is relevant for your MAR and actually displays on your MAR, those are the sections that I covered today. So if you get to this screen and you realize I'm missing information, you can still choose to continue and have a fully functional MAR in Therap. The system also warns you that once your MAR has been approved, you can't make any changes beyond the end date, the end time, and the attachment. And it asks, are you sure you want to submit? So you go ahead and you click on yes. Then the system is going to cross-check for any contraindications and or allergies between the med that you just added and any other medications that the individual may be on. For this particular example, you can see that this Advil that I'm adding may potentially cause an allergic reaction because I've identified in the system that she has a reaction to naproxen. Her reaction is a red rash on her forearms and back, as well as small raised bumps because this drug has an NSAID. Okay, so you do get warnings here. It also lets you know about any other drug contraindication. And at this point, if you're unsure, you can hit no, save the form, speak to the clinician, determine if that's appropriate. But assuming that all is well, and this is a scenario where the risks, or rather the benefits outweigh the risks, you would go ahead and hit yes to submit your medication to the MAR. When you do that, on the original pharmacy message, a couple of things happen. First things first, the status of the message changes. So it's no longer pending acknowledgement, it is now acknowledged. It's also going to fall off of your to-do tab. So if I go back to my to-do tab, I'm not going to have any more high-level messages because I had to and I addressed to. On the pharmacy message for reference, It also will add the name, the title, the date, and the time of the user who has acknowledged the message. So if there's any question about who said, "Thanks for letting me know," you have that title, the name, the date, and the time. If a medication was created as a result of the information that the pharmacy has sent, that medication, the one that we just did, will be listed here, and it will show the date and the time that that was done as well as its status. And if necessary, you can click on Show to revisit the form and see, hey, here's this medication that I created. Here's the embedded pharmacy message, so I can compare what the pharmacy said to what was ultimately placed on the mark. Okay? All right. So I'm going to go back to the dashboard. A couple of housekeeping things that are important to know. As I mentioned, I no longer have any high-level messages because I had two. I acknowledged one, and I acknowledged and created the other. The important thing to know about these pharmacy message counts is that they are shared. They work a little bit differently than some of the other counts that you might see on your dashboard. For example, when a T-log is written about Brittany, if Brittany has 3 staff, each staff needs to independently go into his or her profile and acknowledge Brittany's T-log. So all 3 of us need to go in separately and say, yes, I've seen this T-log. I'm going to mark it as read. With a pharmacy message, the opposite is true. When a message shows up or a count shows up, all 3 of us staff are going to see it. But if one of us goes in there and hits acknowledge, so if I go in there and I hit acknowledge, everyone else's counts are going to disappear as well. So at the top of the shift, all 3 staff had 2 high-level messages, but I went in there and I addressed both of those high-level messages, so none of the staff now have high-level messages. And the rationale for that is you don't want 3 staff adding the one Tylenol to the same MAR, because then we'd have a triplicate of that medication. Okay, and I say this because it's important for folks to know as it relates to pharmacy messages that you really truly should only be looking at them, addressing them, acknowledging them if you are in fact reviewing that data, because once you click on either of those options, you make it disappear for other staff as well. They can still access it. Okay, so if I wanted to be able to go back and see those 2 messages that were acknowledged, obviously I don't have the count, but I certainly can do a search either from my to-do tab, so right here where it says search, or I can go to my health tab where I'm going to have a pharmacy message section and I can search there as well. So I might come in here and say, I want to look up all acknowledged messages for Brittany on a particular day or for a particular medication by selecting her name, selecting the status, and then hitting search. And so I can bring up those 2 messages that are now gone from my to-do tab. This is also how you would access any messages that you filtered out. So for example, if you turned off refill notifications, so you were not getting those counts on your to-do tab, but then you realize, I don't have any more Advil. Did the pharmacy send out a new blister pack? You can come directly to this search section and you can filter by refill order, or specifically by order control, and pull them up that way and see, yes, it was sent, no, it wasn't sent, even though those counts aren't on your dashboard. So we can see here, okay, going back, here are the 2 messages that I acknowledged. I can see that only one of them was a medication created from, and that's listed here.
Fayon?
Yes, ma'am. Can you hear me? Was there a question? All right, guess not. All righty.
So we weren't able to see the full.
What weren't you able to see?
There we go. We're on the pharmacy message group search now.
Okay. So can you repeat what it was that you weren't able to see? I can go back and review it.
Right before you got to here.
Okay. Sure. So what I did is I came over to my health tab. You can also do this from your to-do tab. And I did a pharmacy message search. So if there's anything that was previously acknowledged and therefore is no longer on your to-do tab, or anything that you filtered out so that it never appeared on your to-do tab, you still have access to that information by coming in here and doing a search. So the particular example that I used was I came in here and I searched for messages for Brittany. There she goes. And I looked for things that were already acknowledged. If you're looking to find something that you filtered out, you might also choose to use one of these order control options. But long story short, you can search for data by coming in here and doing a pharmacy message search and bringing that up. And I did want to point out that I addressed 2 messages, but I only created 1 medication. So I can see that right here. This was acknowledged, but no med was created. This one was acknowledged and a med was created. And so you would sort of wash, rinse, repeat for however many messages you needed to add for that person. Once that was complete, the final step is to review your MAR for accuracy and approve it. And that is what we call a configuration. So for the users who have the MAR configuration role, you can click on New, pull up that person. Okay, so here's Brittany. I'm going to switch over to the April MAR just so visually there's a lot more for folks to be able to see since we're at the last day of the month. But I'm going to open this up, and we do allow you to do the current month.
We're still in your pharmacy message group.
You're still seeing my pharmacy message group. Okay.
There might be a slight delay, just a little bit of lagging going on.
All right, let's see if we can fix that. All right, let's see. What are you all seeing now?
Just the actual Therap pharmacy interface detailed overview, the intro.
Okay, there is definitely a lag. All right, hang on, let me try something else. Okay, how about now? Is that any better?
It's still the same. Might be a storm coming your way, I think, but it's just still the GoToWebinar page.
All right, let me try to change some configurations here, see if that makes it any better. Hang on 1 second.
Now we're on the MAR configuration selection.
Awesome.
Perfect.
Okay, so I'll just go back a little bit since you guys couldn't see how I got there. But again, the final step is to review and approve your MARs. That option is going to be in your Health tab via what we call a configuration. When you click on New, you'll select your service and your person. And for training purposes today, I'm just going to go ahead and switch over to our April MAR since today is the last day of March. I do want to make a note where we do allow you to prepare, review, and approve your MARs for the current month plus 2 months forward. So we're in March. I can do March, April, and May. As of tomorrow, I'll be able to do April, May, and June. So I'm going to pull up April's MAR. And the system will then display the medications that have been entered according to how you set them up when you acknowledged and created them from the pharmacy. If you have any medications that were entered manually, they will display here as well. So the interface can work in conjunction with manual entries. If there's an emergency, you had to pick up something from your local pharmacy, or anything like that that's sort of an over-the-counter, maybe isn't sent in by the pharmacy, you do have the ability to enter those. But the system will then display the information in this MAR preview format based on what was sent over from the pharmacy. So here's that Advil that we added. Here's our strength. We can see our quantity, our instructions. We had changed that time to 8:30 and our instructions. Okay, so we will review this, make sure everything looks good. There are additional medications on my MAR that I'd previously added prior to the start of this session. So again, I do get a complete picture of what my MAR is going to look like, anything that was added manually, anything that was added via the interface. If there's anything that I need to change or anything that looks incorrect, I can revisit it by going to the medication in question. So here's the Advil we did together. Something's not quite right about this. It actually should have been at 8 o'clock instead of 8:30. I can click on it. I can open it right back up. I can see my linked pharmacy message. So again, if there's ever a discrepancy between what ends up on the MAR and what I actually entered, here's what the pharmacy sent. Here's what I actually put in. And so I'm going to come back. I'm going to change this because it really should have been 8 a.m. instead of 8:30. Whatever update or edit it was that I needed to make, and I can resubmit it. If I realize I created a duplicate, I put a medication on there one time too many, I do have the option to delete prior to approval. If it's already been approved, this delete option will disappear, and I'll have the ability to either discontinue it outright and just stop it, or discontinue this version and create a copy to make the edit. So for now, I've made my changes directly. System's going to issue those same warnings that we saw before because it checks every time we make an update. It's going to take me back to my page where I can now see that it's 8 a.m. And if this otherwise looks good to folks and there's nothing else that we need to change, we can approve it. At the time that the MAR is approved, that is when it becomes visible to my staff for data entry. Everything that I was doing prior to this process, if they went in and they attempted to look at the MAR, they would have gotten an error message saying, no MAR is available for this individual. So if I'm a staff person who's looking to document, and I go in and try to pull up the MAR for Brittany, in this case for March, because I didn't approve her March MAR, it tells me there is no MAR available, okay? Once the MAR has been approved, and I'll go in here and I'll just approve the March version. Approve that. Our MARs are good for 1 month at a time from the first day of the month through the last day of the month. But now that it has been approved, when I go in as a staff, I click on record, I pull up Brittany's name, I can now see her MAR, I can see her photo, I can see her ID number, I can see her date of birth, and then I'll see those medications. Since the MAR was only approved for the last day of the month, only that last day of the month is highlighted and has those green squares. Documenting in the MAR is straightforward, provided right person, right place, right time. Here's this trileptal, it was due at 1:30. It's 1:54 my local time. I gave the medication, she took the medication. I just have to check on that box to add my initials. If I'm doing multiple meds, so she has a 1:30 trileptal and a 2 o'clock vitamin D3, which I've given, I tab on both boxes and I can scroll down and save, and I am done with that. If there's anything unusual going on, she refuses a medication or she was out at a doctor's appointment, so I wasn't able to give a med, we do have a detail option. So if I click on that and then select the section, I can say she was on a leave of absence. Okay. My choices are miss, refuse, leave of absence, on hold, etc. And I can indicate she went to the doctor. Whatever option I've selected, the MAR will update the square to reflect it. There is a legend here at the top, okay, so I can see what the differences in the colors mean. For PRNs, those do not have a grid because Obviously, there is no expected date or time for them to be given, so the default is that they are always recorded in detail mode. It looks very similar. You can come in here and say I administered it on this date. Oops, wrong date. On this date, at this time, so it's about, we'll say 1:45. And then I would put why. You know, she was complaining of knee pain. I can then save it, and it will appear on my MAR as administered on this date at this time with my initial. The system will then offer the option for a follow-up, so that if you require, anytime a PRN is given, that staff have to go back after a period of time and indicate if it was effective. There is that follow-up option for them to do that. So that's the entire process from start to finish. The pharmacy sends you a notification. It appears on your to-do tab. You have the ability to review that information and decide if you would like to create it for your MAR, in which case you would click on Acknowledge and Create. When you hit Acknowledge and Create, it adds it to your MAR queue. You would do that for however many medications you need, 1, 2, 10, 34. And once you are done adding all of the medications that you needed, you would do a final review and approval in configuration. Once the configuration is approved, your staff can then see the MAR and they can begin to document on the MAR. Moving forward, you do not need to add all of your medications over and over and over from 1 month to the next. The medications will roll over on your MAR based on the start and stop dates if applicable. And so once a month, you just look at your MAR, make sure it looks good, approve it so that your staff can see. Any questions? Okay, so there's a question that says, will the MAR update on the last day of the month for the next month, or does it need to be done after midnight? You can prepare your MARs up to 2 months in advance. So today is March 31st. I want to get my April MAR ready. I could do that today. I could have done it 2 weeks ago. I could have done it 2 months ago. So I'll show you what I mean. Today is March. I want to be proactive, and I want to get my May MARs ready. Not even April. I want to get May ready. I would come into configuration. I'd click on New. I'd select my service. I'd select my person. So here's Brittany, and I'd change the month to May. Here's my May MAR, locked, loaded, ready to go. I'd review it, of course, to make sure that everything is the way that it's supposed to be. But the expectation is there isn't any change, because if there was, I would have had to approve it. So if all looks well, I'm just going to come down to the bottom. I'm going to approve, and now my MARs are ready to go for May. So on April 30th, midnight, May 1 comes in. I don't need to do anything. I've already taken care of this back in March. Let's see.
Hey, and I have a question for you that came up before.
Sure.
So if you configured future MARs like you did for today, for May, but then a medication changed, making the change on the, let's say, March 31st or the April MAR, will that also change on the May one?
Let's find out. So if I open this up and I'm going to make a change. I'm going to come in here and I'm going to discontinue this Tylenol. Okay, so I'll open it up. I'm going to discontinue it. It's no longer valid. I'm going to discontinue it for today's date. So we'll just put that it was DC'd. Okay, so it's DC'd. I approve that change. Now let's see if there is any difference noted for that MAR, if it locks the MAR. So I'm searching for Brittany. I'm looking for all of her approved MARs. So you can see that I did April, I did March, April, and May. And you can see that, yes, the MAR is locked. So I previously approved it, but it's changed. It used to have that Tylenol on it. The Tylenol has been DC'd. So at some point, I would need to come back in here because there was a change. I can verify that my Tylenol is gone. It is. And reapprove it. So if you do approve in advance, but there is a subsequent change, it will require you to reapprove. And you can always find any MARs that were previously approved but require a change by doing a search. I can do a search. I can say, show me all MARs that are locked, meaning they require me to go in and reapprove them. And it looks like I have 4 locked MARs. I've got Brittany's March MAR, I've got her April MAR, I've got et cetera, et cetera, et cetera. So if there was a change after you did that approval because you did it 2 months in advance, you could search for them and reapprove them again. Any other questions?
Perfect. Thank you so much.
All right. If you guys have questions, please don't hesitate to reach out. As I mentioned, this will be recorded and posted on our website. You can also feel free to visit our support site. So if you are logged into the application, you can come over to Help and Support, and you can type in Pharmacy Interface to access any of our training materials. I type in Pharmacy Interface.
We have one more question, Fayon. If you could repeat the names of the pharmacy software packages.
Sure. It's QS1, SpeedScript, and Framework LTC.